the Chairperson and Malaria Council, the Chairperson and Malaria Fund, the Coordinator and Malaria Council, the team members of Malaria Council, the representatives of the Health and Wellness Center, media houses present, the management team of LEAP Medical Services, invited guests, ladies and gentlemen. A very good afternoon to you all. My name is Dr. Joy Jeevan Kumar, a team member of LEAP Medical Services and your program director today. It is an honor to welcome you all to today's event as we embark on a journey of collaboration as one team to serve our community. We as LEAP Medical Services aim to provide all our patients with the best medical care within this beautiful and serene and secure environment as you see all around you. As Hippocrates said himself, wherever the art of medicine is loved, there is also a love for humanity. Ladies and gentlemen, at LEAP, we prioritize action, accountability, resource mobilization, and advocacy as we combat health ailments affecting our communities. And who better to have with us today than the End Malaria Council and Fund, with whom we share our core values with. Malaria has been a persistent global health threat, claiming many lives each year, and as medical professionals, we understand the urgency of addressing this crisis hand-on. Today marks a pivotal moment as we join forces with the End Malaria Council and Fund to bring together the expertise of our esteemed hospital and the relentless dedication of the Council to eradicate malaria. As LEAP Medical Services, we are honored to contribute our resources, our knowledge, and skilled healthcare professionals to your noble cause. Through this collaboration, we aim not only to provide comprehensive medical support, but also to actively engage in our research, innovation, eradication of malaria, and country and community outreach. Together, we envision a future where malaria no longer casts a dark shadow over vulnerable populations. By combining our strengths, we can implement innovative strategies, leveraging cutting-edge technologies, and foster a collective determination to make a lasting impact. To the doctors, nurses, research, staff of the organizations present, media houses, and esteemed members of the community, I would like to extend my deepest gratitude for being here, for your unwavering commitment to the well-being of our communities. At this moment in time, it gives me great pleasure and a great honor to introduce a visionary leader, a compassionate advocate for healthcare, and our esteemed medical director, Madam Wezi Mikandawire-Nimbili. With a wealth of experience and a passion to make a difference, Madam Wezi has played a pivotal role in shaping the healthcare landscape of our institution. Today, she stands before you as a driving force behind our collaboration with the End Malaria Council and has not only dedicated her advancing of medical care, but also her compassionate initiatives aimed at addressing the global health challenges. Her leadership has been instrumental in fostering a culture of innovation and excellence. Without further ado, please join with me in welcoming my medical director, Mrs. Wezi Mikandawire-Nimbili, as she shares her insights.
The Chairperson, End Malaria Council, Dr. Godwin Vene. The Chairperson, End Malaria Fund, Mr. Peter Cotton. The Coordinator, End Malaria Council, Dr. Elizabeth Chizema. LEAP Medical Services Management, media houses present, ladies and gentlemen. I am greatly honored by the presence of distinguished guests on this momentous occasion to witness the signing of the Memorandum of Understanding between LEAP Medical Services and the End Malaria Council. LEAP Medical Services is a private medical facility wholly owned by Zambians, I must emphasize proudly. At LEAP, our focus is maintenance and restoration of our clients' well-being. The medical suite situated within the state-of-art, the Health and Wellness Center, allows us to provide interlinked wellness services under one roof. Our primary services include general and specialist consultation, mental health, physiotherapy, and specialized surgical interventions such as orthopedics, plastic and reconstructive surgeries. Through our partners at the center, we also cater for diagnostic laboratory services, dialysis, nutrition, yoga, wellness spa, women and children wellness services. The chair, sir, just to let you know, the center will soon be adding dental and wellness X-ray and CT scan imaging to our range of services very soon. On the public health front, the country is currently reeling from the cholera epidemic. There has also been reports of sporadic cases of COVID-19. As we go on with the program, our doctor, Dr. Seville, who is a specialist in this area, will shed more light. In collaboration with the Ministry of Health, we are enforcing the message of prevention at every contact with our clients and through our social media platforms. To achieve wider coverage of the population, we are also working towards establishing a satellite COVID-19 vaccine site at LEAP Medical Services. We believe in the philosophy prevention is better than cure. The fight against malaria is best fought by averting infection. This partnership with the Malaria Council is an opportunity for LEAP Medical Services to contribute towards the eradication of malaria. We will work hand in hand with the leadership of the Malaria Council as it implements its mandate. This memorandum of understanding will specifically focus on resource mobilization and advocacy. Through our technical expertise and extensive networks, we shall contribute to the mobilization of funds to cushion the budget at the operational levels. Additionally, we will work with the Council in getting the malaria agenda to reach the necessary decision-making tables within the country and beyond. We are delighted to join the fight. Together, we can eliminate malaria. The signing of this Memorandum of Understanding is timely. I thank you all.
They say leadership is wanting to do something new and better and getting others to tag along with you and doing it even better. Ladies and gentlemen, it is both an honor and my privilege to introduce the distinguished individual whose leadership has been instrumental in driving the change and inspiring the hope in the global fight against malaria. Please join me in welcoming to the stage the chairperson of End Malaria Fund, Mr. Peter Cotton, please.
Good afternoon, ladies and gentlemen, and distinguished guests. I'm very honored to be here. And I just want to say that the background to us having this event today is quite amazing, as our chair mentioned in our introduction, that it was only a few weeks ago that Wezi and I first met each other with the chair when we were touring the stands at our Lusaka Marathon. So to move it on so quickly to the points of MoU, it just goes to show how fast that we work under a PPP with a public-private sector partnership as the Malaria Council. But also, congratulations to you, Wezi, and your team, of how fast you work. I mean, as you know, I've been here 35 years and I've been working on projects like this for a lot of years. And I must say, you really, really have surprised me how quickly and how well you've put everything together to get to this point today. We've in fact had 3 meetings, Chair, quietly behind, the scenes, so that we could achieve this today. And I'm very impressed that my whole team and the Chair and our coordinator, Dr. Jazema, who's just come back from Namibia, are all present today because we wanted to prove to you how important this partnership is. Now, the fight against malaria, we do not want it to take a backseat role as it did when the first COVID pandemic came out. We went backwards at least 2 years because all the resources, and I'm responsible for resource mobilization with my committee and board, basically was shunned to one side. And we had to come through that period with virtually no resources and no support. And even the awareness and advocacy dropped because it all focused on that side. So it's pleasing now, or we hope anyway, that COVID is just another disease out there, like any other. And we are sitting, as the docs know here, with so many diseases in the hospitals at the moment. So we're fighting to make sure that on the advocacy side, malaria is the #1 fight, because we believe it's the #1 problem in this country. But we cannot do it alone. We can only do it with partners. And our partners are made up of donors overseas who give us the majority of our funding. and they are represented on our boards, and we work very, very closely with them, and we're accountable to them, and we really thank them for that. Government is another major partner. They doubled their budget to us in 2023 for drugs and resources. So government are a very important partner of the Malaria Council. And then the private sector, which the chair and I represent under the true PPP. It's probably one of the few PPPs, Chair, that honestly works, because we, all three of us, basically donors, the public sector and the private sector, work hand in hand together to try and get to where we are today, to have partnerships like this. And we've signed a number of MoUs in the past few weeks, and we've been tireless in the last 3 months, as Dr. Zema knows, and she's been traveling a lot as well, because we realize that we cannot accept these 4 deaths a day. So we have got a planning meeting at the end of this month for 2024, because we want to make sure we keep the gas on the pedal, like we're proving today, so we can really make a difference. We've got a very good rain season here. God has blessed us. The maize is growing fantastic. But we know what comes with the rains is cholera, typhoid, COVID because of the colder weather, malaria because of the mosquitoes. So if we can make a dent after a year like this, then it means we are doing something good. Our very own Dr. Zema, we must applaud her, because she's been selected to move amongst all the regional partners to recreate what we created in this country, in Malaria Council, because the structure proves it works in order to take it all the way down to the common person for, as you quite rightly said in your fantastic speeches, prevention and cure. Because don't forget, the cure side of it is you cannot have individuals moving around with a parasite in them, basically transmitting it on to others. That's how we get imported cases coming into provinces and countries and so on. So it has to be side by side. It has to be prevention and cure, because we have to test them, treat them, eradicate the parasite, and move on. So we've got a tremendous job. So resource mobilization is critical. We cannot end malaria without funds. If we have plenty of money thrown at us now, we will not have 4 deaths a day, because we know how to stop it. We know how to stop the deaths, don't we, Chair? And we know also how to eradicate malaria, because there are a few countries in Africa, and we applaud them, and they're our inspiration, that have 0 malaria. So if they can do it, we can do it, but we can only do it if we do it together. Thank you very much.
As medical professionals, there's the saying, if you can't cure it, try to control it. If you can control it, try to prevent it. And our goal, as this MoU will be signed today, is to do our best in order to eliminate and eradicate malaria from Zambia, and we drive inspiration from all the other countries, as Mr. Cotton has said, in order to do so. At this moment, it is my honor to introduce a visionary leader whose tireless efforts have been a driving force behind the impactful initiatives of the Malaria Council in ending it and eradicating it. The journey to end malaria is a testament to the power of collaboration, and I believe that is why we are here today. With great anticipation, let us welcome Chairperson of End Malaria Council, Dr. Godwin Bene.
So thank you, colleagues in the EMC. Thank you, Director, and your team. And thank you, media. We rely on you to get heard. And I hope that we can use the platform to do that. This occasion is emphasizing the desire of the End Malaria Council to accelerate the fight against malaria, which we are all at risk of suffering from. There's nobody exempted. Doesn't matter where you live, what you do, how prosperous or how poor you are. That little mosquito, if it picks you out, it will come for you. Okay, and that's a short message which I have here in so doing. As my colleague has said, Mr. Cotton, a death rate of person, and we'll repeat this as often as we can, as loudly as we can, because we must be heard. a death rate of 4 persons per day from a disease which is not only preventable, my dear friends and fellow citizens, but eradicatable, is not acceptable. I just want us to agree about that. It's not acceptable. Okay? So today we are witnessing another momentous occasion where the End Malaria Council of Zambia is partnering with LEAP Medical Services. This partnership is crucial in the prevention and eradication of malaria in Zambia. Okay? So we are going to fight together to get rid of the malaria transmitting mosquito. We talk about malaria disease, but really the problem is it's a mosquito. And my friend there was telling me in my area one about that little black and white one, which is a nuisance. Another one is a mosquito we must, or he's sitting here, is a mosquito that we must tackle. The heads of states and governments in Africa recognize that malaria is a serious problem affecting not only individuals but entire populations. So our leaders recognize and accept that. Okay? The disease, which ravages the rural areas more and certain peri-urban areas, reduces productivity, and that's where the concern is, and therefore affecting our gross domestic product and prosperity. These are the numbers that that other people understand, and it must be of concern to them. So as EMC, we recognize that the malaria burden is not well resourced, and thank you, my colleague, for drumming the message there. Without money, without funds, we'll sit here sign MoUs, and the doctors will think we are just time wasters because we will not get anywhere. Okay? So we need funds. And it's therefore becoming imperative to look at this critically. And Mr. Cotton is in that fact, we want to thank you as MUC for bringing us here. He mentioned this when we were with the ZA the other day, but thank you that you quickly crafted this and we are here. And that shows how enthusiastic Mr. Cotton you are about this. For the same reason, heads of African states and governments decided to create the African Leaders Malaria Alliance, of which our Republican President, Mr. Hakainde, is a member. This approach is necessary to focus on the needs of individual populations, countries, and develop local solutions affecting those countries. I like that term, to develop local solutions. And the developers of that are in this room. I'm not going to look anywhere. We are all here. The creative minds are in this room. Initiatives are emanating from this room. And that's why I like this term, that it's to do with the local solutions, which I think I've seen and dance about one of them just now. So there is a call from our Republican President, who is also the patron of the End Malaria Council, for all of us to join him in the fight against the life of the mosquito. Just get rid of the mosquito, the problem is solved. So it's a mosquito we are trying to. So the members of council are appointed by the patron, just for information. That part was okay. And the Republican president now, himself being the patron. Our mandate as council is threefold. Advocacy, my colleague mentioned this earlier on, resource mobilization, you heard him speak. Then action and accountability. When I came on board as an employee of First Quantum to join forces here, I made it very clear, and I think I said it to Dr. Chizema, that I'm not going to be part of the team that talks and talks and talks and doesn't deliver. I'm an employee of an employer. I'm responsible to my employer, so I don't have to waste time doing something which is not delivered. So we are going to deliver, and I need to quickly, add here that at First Quantum, I've got two colleagues here who work with me in the office. We actually spend quite a lot of money. And that's why our interest in EMCs. We spent a lot of money, millions of dollars per year, to assist government in the fight against malaria in the areas where we operate in this northwestern. So it's worthwhile for us to be here and to see how we team up and to see how we how we take messages out to everybody to understand that it's all worthwhile. So it's about action and being accountable. And for that reason, it's all worthwhile being here. Our membership, again, for information, is sectorial, and I think Mr. Cotton has said enough. We're PPP. I think we are doing very well, but we can do better. I must hasten to say that here at LEAP Medical Facilities, we find you as a strategic partner, and as we sign this MoU, we are hopeful that our joint efforts will leave an indelible mark in the fight against malaria. So it's not just another MoU which we sign and like other MoUs we pack them away and have a good time. No. The MoU is actionable. And I think we may choose to meet again 1 year later on our anniversary to say, what has been the deliverables? Do we need to modify our MoU? We must do that. So today is, what date? Today is 18? So mark it, Madam Director, mark it. You call us in this room 1 year later, we'll drink tea and eat biscuits. The reason will be, how are we doing with the MoU? Okay, because that will feed into our being accountable as AMC and also yourself as LEAP. So partnering with all stakeholders present here is crucial, and as LEAP is crucial. Whereas today we sign a memorandum of understanding with LEAP Medical Services, we are all important in the noble fight for malaria. Let me therefore call upon all of us to join the fight. Companies, employers, individuals, every citizen, together we will win this fight by taking simple hygienic steps. That's where I come in. You can eat everybody. This one you must broadcast it. Okay, listen. Our people must understand that malaria disease kills. Don't play with it. And we are happy to join forces here with the Minister of Health to get this message across. Please, fear the mosquito. When you see one, kill it. Don't say no, don't say no. They will just whack it and kill it. Okay? Number 2, sleep under a net. Now, some people feel that you're going to die because you are sleeping under a net. It's something that I think doctors can help us get off, okay? It's a psychological thing. Sleep under a net, and preferably a treated one. I believe that we are handing out 11 million nets. Essentially, a net to every citizen, isn't it? Every household. So, the government has done its role, and we worked well with them to enable every citizen to get a net. So you will help us get the message across that the nets are not for fishing. The nets are not to put under a brood of chicks. I've seen that in the village. Look, when the chicks are born, they put a net over it. They are not for nurseries to grow. They are for you to sleep under and keep the mosquito away. So when you see one, kill it, sleep under the net. Number 3, take other preventive measures. Please burn a mosquito coil in the rooms where you and your family sleep in. Those coils are available. I think again as a medical team, you can help us get that message across. They are not harmful, they are not dangerous, they don't cause cancer, they don't kill. But they kill the mosquito, or rather they stun the mosquito so that it may live another day, but your life is preserved. So keep it away from you, okay? Install wire mesh on all your windows and doors. For those that haven't got wire mesh, including this building, and we see that behind there you've got a marshy place, that's where mosquitoes are building. So think about putting a wire mesh here. You have one? I didn't see it. Now I'm just testing to see that you have one. But so you're already responding to our efforts, okay? Put on mosquito repellent while resting in the evenings, and if you're traveling to open country, apply a mosquito repellent. These creams are available, they're not expensive, but even if it's expensive, it will still be cheaper than a bottle of moss. It's cheaper than a pack of cigarettes. It's cheaper than one of those that are really harmful. Just, okay, apply it on yourself and go. Soon you start feeling like you have malaria or see such symptoms in children and the aged, particularly, please get them tested. Get tested, get them tested. This is a message you are putting out. We are using this occasion to put out this message to the listeners. Or take the malaria medicine if you are unable to get clinical and you are far away. You know, that's something which I don't think medical people encourage. But if I find myself near to Timbuktu and it would take me a week to get to hospital, I think I should take the medicine. And I can explain to my doctor, actually I took Fancida, you know, and so that you know how to look after me. So this is what we want to take advantage of being here, just to mention these things to the general public. Fear the mosquito. From today, be afraid of that little insect. And when you see one, kill it. Start fearing a mosquito. It is a fearless killer. It doesn't care who you are. It will bite you for its own purpose and kill you. So as I end, let me thank you all at Leap Medical Services. Truly thank you. I'm really impressed about what has happened between November now. This is how other people should act, work in this country. You know, we are getting blamed for how we procrastinate, how we talk, how we wish. But so this is idea, action taken. Now we can start wondering what ticks we make in boxes, adding up to a reduction in the number of living mosquitoes and in the number of malaria cases. So I really want to wholeheartedly thank you and remind you that malaria ends with me, malaria ends with me. I'm not wearing my famous band because it broke. So my hands are a bit bigger, so it broke. I will need to get some. And I think that's what you should have done. You should have brought you on the band here. So once again, thank you. We are available on our web page, which I will get our team to broadcast here. We are available on our phone to exchange cards. We have people that are available practically all the time. We work as volunteers. We do this in a free time, and we are just about a phone call away. And we'll be able to answer you and talk about malaria, because we're not happy that 4 people do die. When a grandfather dies, when a grandmother dies, the whole host of wisdom goes into the ground because of mosquito. When an unborn baby dies with a mother, see what you've lost. When an infant dies, we have lost a resource. So we have concerns. When a minor dies, in our case, we may employ another one, but actually we've lost a resource, because training somebody doing this is a hell of a job. So once again, thank you so much. Really, thank you once again for this initiative. And Mr. Cotton, to yourself, for standing with us very firmly as EMC. And let's see what happens. But we'll meet 1 year later to see what has happened. I thank you.
Thank you so much, Dr. Chairperson, sir. He definitely pointed out some of the things we do on a daily basis in order to eradicate malaria towards getting into a malaria-free Zambia. So thank you once again, sir. And one thing that stood out was something that is close to me. You know, we don't believe in violence. I've always been no violence, but I can promise you, Mr. Chairperson, from today I shall go to violence if I see a mosquito, and I will do it for you. Yes. Every night, I will do everything. And I must assure you, at the Wellness Center here, we always try to keep our meshes on, and we make sure that our clients are not exposed to any mosquito at all. And we will continue to do so, sir. As we embark on this momentous collaboration between Leap Medical Services and the End Malaria Council and Fund, I would like to invite to the stage the esteemed chairpersons of the End Malaria Council and End Malaria Fund and the Managing Director of Leap Medical Services to come forth in order to show the instrumental shaping of the vision that we have talked about today. Please join me in welcoming Dr. Bene, Mr. Cotton, and Mrs. Nimbulu to stage.
That's the moment. No, we got two documents. There you go. Yeah.